It's a Fitness Friday here on Power98FM.com. We're on live with the hip-hop doc himself, Mr. Ronnie Whitfield. Good morning.
How you doing, Yasmin?
So how did you get the name the hip-hop doctor?
Yasmin, I've been using music and medicine to educate young people on health issues, and it was a small outreach in my community, and it has gone, for me, international. I was even able to travel to Uganda as a hip-hop doctor, talk to kids in their country about health issues. And the interesting thing was they had similar questions that the kids here asked me in the United States. Why are young people dying from preventable and treatable diseases? You know, in Uganda, there's a lot of HIV, there's a lot of accidents, not as many suicides as we see here, but they have them. And you know, that was interesting to see that they had similar questions that the young people in the United States asked me when I travel around and speak. So just been very, very fortunate, very blessed to travel and try to educate people about how to save their lives and how to live healthier and happier, especially this 2015.
Well, okay, Dr. Whitfield, you know, holidays are over. We had Thanksgiving, we had Christmas, we had New Year's, and we've eaten all of this refined sugar, all of this fat, all these unhealthy, processed, overcooked foods. How do we recuperate in 2015? How do we begin to start the year off right? What kind of, I guess, resets can we do for all of the damage that we did in the latter part of the year last year?
Well, I think, you know, many people are inspired this time of year. They're making promises to themselves, to their families. You know, I'm going to make some personal improvements. You know, I'm going to start running. I'm going to eat healthy. I'm going to drop 20 pounds. And to be quite honest with you, Yasmin, by the mid-March, most of these New Year's resolutions have fallen off the maps. So many people fail diets because these things are not sustainable, and there's such a negative paradigm around them. You know, what I can't eat, what I can't, you know, do. And so inevitably it's hard for many people to sustain this approach. So when people come to me about losing weight and getting a healthier life, especially for the beginning of the year, I always tell them if we want to do something to get healthier, we got to start very, very small. Things that you can put into practice immediately but consistently, and they're not going to really change the way that you live every day. So if you were not exercising at all, if you start walking 5 minutes a day, honestly, Yasmin, that's not going to change your life very much because you probably could find some time when you're leaving work or when you're just getting home to do these things. So I'm always recommending people to do very, very small things. So the top 3 things on my list when patients come in and we sit down and talk and they ask me about all these things, they got their list of the top 10 resolutions, which include things like, you know, getting organized and spending less money, yada, yada, yada. All these things that most people won't do throughout the year. I said when it comes to your health, I encourage you to focus on these 3 things. Eat what you enjoy and what you love, but be very smart about how you choose them. That's the first thing. Take small steps to stay active on a daily basis. And, of course, you got to come see your doctor on a regular basis to keep numbers in check. And what I mean by those numbers, your blood pressure, your cholesterol, your blood sugar, and your weight or your BMI. You need to have these things. You can focus on those 3 things and change those 3 habits throughout the year. You could live a longer, healthier, happier life.
Okay, so Dr. Whitfield, you're the hip-hop doc.
Yes.
And we know twerking goes along with hip-hop.
Oh, yeah, okay. Yes,
So tell me, how many calories can we actually burn by, let's say, dancing for 15, 20 minutes? Maybe not necessarily twerking, but at least putting on some music and dancing to it.
You can burn a significant amount of calories twerking or dancing for 15 minutes. It depends on how hard you're twerking and working. But I think the key to it is that you're moving every day. And is it ballroom dancing? Is it twerking? Is it doing the nay-nay? If you're actively doing these things, you can burn calories. So, again, you're speaking to one of my points, taking small steps, literally, meaning you have to move every day. So it can be dancing, gardening, fishing. Well, not so much fishing because you're sitting a lot, but if you're actively moving things around, you're actually doing cutting the grass is a form of exercise. So I often don't use the word exercise. I say physical activity. I think even more important is about eating. Say you have some disability. I got a question earlier this morning. Doc, I hurt my ankle. I'm not able to exercise. Well, we've got to eat healthy. So a balanced diet, healthy breakfasts. If you're a soda lover, you can still drink Coca-Cola, but maybe you just want to choose the Coca-Cola mini can, which only has 90 calories. So, I mean, there are definitely things that we can do, but you have to be smart about it and know that if you're going to have a big, heavy meal on Easter or Easter Sunday, what's coming up down here, Mardi Gras coming up, or Super Bowl Sunday's coming up,
right.
That week you want to be smart in the choices of the foods that you eat and be more active during that week if you can.
Okay, so speaking to our young people, a lot of them are on a budget. You know, a lot of us grown folks are on a budget. And for some reason in this country, fast food is a lot cheaper than healthier food. So do you have any tips on how you can get some of those organic vegetables or some of those healthier options when you really do have a limited amount of money?
research the food co-ops and, of course, our markets, our fresh markets. In a lot of cities, they're fresh markets. And that same tomato that costs $2 at one of the higher-end organic stores, and I won't call any names, but you know what I'm talking about.
Right.
You can find at the fresh market, you get 3 for, or get 6 for $2. So there are ways we've got to, again, be smart about our food choices and selections. You know, food co-ops are really big in certain cities, and, you know, you can go and find food in bulk and it's in very cheap prices. And you want to eat what's in season. You know, fresh is always best in my opinion, so I like to eat fresh fruit and fresh vegetables. But sometimes there are other alternatives in the cans that you can use that are just as healthy. You know, of course, we need to know how to read those labels, but you've got to do your own research. And, yeah, I agree with you. In many cases, fast food is not only expensive, but it's easily accessible, and it's fast. You can drive through the drive-thru and get that stuff given to you. You don't have to go home and cook. But I have a 9-year-old daughter, and we're in the kitchen now cooking, and this has been a pleasure to see her mess up and me mess up, and we try to do these different experiments because not only are we learning more about each other and bonding, but we're also learning how to cook. And it's always good to prepare things at home, and that family connection and bond is really, really good. But as young people on a budget, yeah, do your own research. And there are some quick meals that you can prepare that are healthy and nutritious, but you've got to do some research when you're out there looking for them.
Well, before we wrap up, there's a lot of diseases that affect the older population, but what are some of the ailments, diseases, issues that you see affecting the younger population, and what some of the young people really need to keep an eye on and watch out for?
What's really scary and sad now, you've got young people that are taking the same medicines as their parents. So the high blood pressure, high cholesterol, diabetes, obesity, and you can even see heart disease and stroke in young pediatric patients now because of how we're living. So that's why this message today to me is key and very important. You can still enjoy some of the things that you love and the things that you enjoy, but again, moderation and balance. So, yeah, I'm seeing, unfortunately, hypertension, heart disease in very, very young people because they're not subscribing to these very, what I call basic and simple survival things that you need to do, you know, maintaining a healthy diet, exercising on a daily basis. If you smoke, not smoking. Unfortunately, in our country, young people are not smoking as much, but there's other things that are going on out there as well. Drugs of abuse. I'm a medical director of substance abuse center. I work at the prison, so I see a lot of the ill effects of substance abuse on individuals in our community. So, you know, we've got a lot of things that we need to address not outside of just health, but substance abuse as well as mental health. Also, we're reducing stress in our lives. So I'm seeing people coming in young age with anxiety, depression as well. So a lot of things that we need to address. But again, our most important possession is our health, and without our health, we're nothing. So we've got to focus on it. And starting this month is good. Let's wipe the slate clean. Let's see our doctor this month, and make a list of those small, attainable goals that you want to do, things that are doable, and get started.
Thank you so much, Dr. Whitfield. Give out your social media or where people can find some more of your tips and information that you have on staying healthy.
Definitely check me out on Instagram or Twitter at the Hip Hop Doc. That's THA Hip Hop Doc. On Twitter, Instagram is the best way to catch me. And then for some good information just on general health and hypertension, diabetes, familydoctor.org is a really good site as well.
All right. Well, thank you so much for your time, and I wish you health and success in 2015.
You as well, Yasmin. Set those small, attainable goals for me.